when a woman experiences pain with penetration or touch. But some women have a lax pelvic floor, particularly women who are quite significantly overweight, women who've had multiple pregnancies, women who've had big babies, women who, unfortunately, during labor were encouraged to push by a enthusiastic nurse or doctor, um, because they want to, take a break. So they want the woman to push, and the woman can push for 3, 4, 5 hours. I think that's absolutely criminal, and that can actually damage the pelvic floor. And certainly, actually, after menopause, women tend to some women will have incontinence or bladder leakage because of the lack of estrogen. So the estrogen contributes to collagen formation, and collagen is what forms a matrix in our tissues. Many women will recognize this. As we get older, we get wrinkles, often from sun damage, but predominantly because of the loss of estrogen, loss of collagen, and we get wrinkles. And then the same sort of stuff is happening in the pelvic area, in that the organs, the bladder predominantly, the uterus to a slightly lesser extent, already held up by the pelvic architecture, we call it. And with loss of collagen, with aging, urinary tract infections are more common. So, here's a little pearl. If you are a woman who is experiencing urinary tract infections, certainly around the time, sort of later perimenopause, and certainly after menopause. So often postmenopausal women will have repeated urinary tract infections, and they're put on antibiotic after antibiotic after antibiotic, will often be prescribed, antibiotics for long term, which has all kinds of impacts on the gut and everything else.